In the name of God, in this session we continue to study the individual bones of the skull. At first, we can see parietal bone. The parietal bone has 4 borders. The anterior border is articulated with frontal bone. The posterior border is articulated with occipital bone. The superior border is articulated with opposite parietal bone, and the inferior border is articulated with temporal bone. This figure shows me internal surface of the parietal bone contain numerous arterial sulcus. This sulcus appears reason contact of arterial to internal surface of the parietal bone. Temporal bone has 5 parts: squamous part, mastoid part, tympanic part, styloid process, and petrous part. In this view, you can see some part of the squamous part of the temporal bone. Zygomatic process, articular tubercle, mandibular fossa, supramastoid crest, suprameatal triangle are a part of a squamous part of the temporal bone. In addition, you can see superior border of the external acoustic meatus is completed by a squamous part of temporal bone. You can see external acoustic meatus is formed mainly by tympanic part of temporal bone and is completed by a squamous part of temporal bone. This is internal surface of the temporal bone. You can see petrous part. The petrous part has anterior surface, posterior surface, and inferior surface. The anterior surface contains arcuate eminence, trigeminal impression, and sulcus for lesser and greater petrosal nerve. Lesser and greater petrosal nerve. The apex of the petrous contribute to formation of foramen lacerum. This view is inferior surface of the temporal bone. You can see inferior surface of petrous part of temporal bone contain opening of the carotid canal and jugular fossa. Opening of the carotid canal and jugular fossa. In addition, you can see a styloid process. The base of the styloid process is vaginated, is sheeted by vaginal process of tympanic part of temporal bone. In floor of the mandibular fossa, you can see this fissure that is called petrotympanic fissure. Petrotympanic fissure. Medial side of the mastoid process contain mastoid notch and occipital groove. The occipital groove or sulcus for occipital artery is medial to mastoid notch. This one is coronal section of the mastoid process. You can see numerous air cells into the mastoid process. These air cells connect to middle cranial cavity. The middle cranial cavity connect to pharynx by eustachian tube, auditory tube. When you are swimming, the water can penetrate, can pass through oral cavity, pharynx, eustachian tube into the middle ear. This water can enter into the mastoid air cells from inner ear. This phenomenon produces bad pain, exaggerated pain in the mastoid process because the mastoid air cells involve inflammation that is called mastoiditis. This one is zygomatic bone, has a body, frontal process, and temporal process. The landmark of the body is zygomatico-facial foramen. There is zygomatico-temporal foramen on temporal process. On temporal process. Maxilla forms main part of the face and contain body, zygomatic process, frontal process, alveolar process, and palatine process. Anterior surface of the body has inferior orbital foramen or infraorbital foramen, nasal notch, and anterior nasal spine. The alveolar process has a canine eminence, incisive fossa, and canine fossa. The incisive fossa is medial to canine eminence. The canine fossa is lateral to canine eminence. Posterior surface of the body of the maxilla contain maxillary tuberosity. Maxillary tuberosity. This figure shows you medial surface of the body of the sphenoid that is called nasal surface because contribute to formation of lateral wall of the nasal cavity. The medial surface of the body of the maxilla contain opening of the maxillary sinus that is called maxillary hiatus. There is a groove in front of it that is called nasolacrimal groove, and there is a groove behind it that is called greater palatine groove. The nasolacrimal groove changed to nasolacrimal canal by articulation of the maxilla with lacrimal bone. The greater palatine groove changed to the greater palatine canal by articulation of the maxilla with palatine bone. In this figure, you understand the hiatus of the maxillary is very, very large, but this hiatus is narrow by, this one is hiatus of the maxilla, is narrow by ethmoid bone above, lacrimal bone anteriorly, inferior nasal concha, lacrimal bone above, ethmoid bone above, lacrimal bone anteriorly, inferior nasal concha inferiorly and palatine bone posteriorly. In other hand, the hiatus of the maxillary is narrow by many bones. Many bones bounded the hiatus of the maxillary. The ethmoid bone superiorly, lacrimal bone anteriorly, inferior nasal concha inferiorly, and palatine bone posteriorly. In this figure, you can see sphenopalatine foramen. This one is a sphenopalatine notch of vertical plate of palatine bone. This notch changed to foramen by articulation with sphenoid bone. In this figure, you can see palatine process of the maxillary bone that forms main part of the hard palate. From anterior to posterior, you can see incisive fossa has in each side incisive foramen that connect oral cavity to nasal cavity. Behind it, you can see intermaxillary suture and palatomaxillary suture. The palatomaxillary suture terminate to greater palatine canal or greater palatine foramen. The greater palatine canal forms by medial surface of the maxilla and palatine bone. This one is palatine bone. Has perpendicular or vertical plate and horizontal plate. There is a process between them that is called pyramid process that contribute to formation of the hard palate. This one is pyramidal process of palatine bone. Okay. The superior border of vertical plate or perpendicular plate of the palatine bone from anterior to posterior, there are orbital process, sphenopalatine notch, and sphenoidal process. The orbital process contributes to formation of fluor of the orbital cavity. The sphenopalatine notch changed to sphenopalatine foramen by articulation with sphenoid bone. This foramen connects nasal cavity to pterygopalatine fossa. This one is vomer bone or septal bone of the nose. The vomer contribute to formation of the septum of the nose, medial wall of the nose. The superior border of the vomer articulate with sphenoid bone, and the anterior border of the vomer articulate with perpendicular plate of ethmoid bone. This one is hyoid bone. The hyoid bone suspend in the neck by some muscles and ligaments. The hyoid bone has a body anteriorly and a lesser horn and greater horn laterally. And in this figure you can see cervical vertebra. There are 7 cervical vertebrae in the neck. Cervical vertebra 3rd, 4th, 5, and 6 are typic vertebra because 3rd, 4th, 5th, 6th are typical vertebra because contain a body anteriorly and a bifid spinous process posteriorly. All cervical vertebra has a foramen transversum or transverse foramen. Okay, this one is a typical vertebra because addition of transverse foramen, you can see a body anteriorly and a spinous process, bifid spinous process posteriorly. The gap between right and left horn of spinous process is occupied by ligamentum nocae, cervical ligament. For this reason, you cannot touch the spinous process of the cervical vertebra posteriorly because this notch is occupied by ligamentum nocae. Atypical vertebra are cervical vertebra, axis vertebra, and seventh cervical vertebra. The first cervical vertebra or atlas has not body and spinous process because it is an atypical vertebra. In each side has an articular surface with articulated with occipital bone and forms atlanto-occipital joint. This one is axis or second cervical vertebra that has a process that is called dens. When a person is suspended, this process, dens, is fractured and pressure on spinal cord. For this reason, the person is dead. The pressure and dens on spinal cord. In this figure, you can see first and second cervical vertebra has a landmark of the cervical vertebra that is called transverse foramen. This one is seventh cervical vertebra. This is an atypical vertebra because the spinous process is unified, no bifid. Is unified. And for this reason, there is no ligamentum nocae, and for this reason, you can touch this process on posterior surface of the neck. When you follow from above to below in posterior surface of the neck, when you touch a spinous process, this spinous process belongs to seventh cervical vertebra. Okay? Paranasal sinus. There is around the nose nasal cavity many cavities that are called paranasal sinuses. For example, frontal sinuses, ethmoidal sinuses, anterior, middle, and posterior, maxillary sinuses, and sphenoidal sinuses. All of them have secretion, and this substance drain into the nasal cavity. What's function of the paranasal sinus? The paranasal sinus warm and filtered inspired air. The paranasal sinus produce produce a tone in our voice. Paranasal sinus increase pitch of the sound. For this reason, when the paranasal sinus is filled by secretion, your voice is changed. This one is frontal sinuses. The landmark of frontal sinuses is superciliary arch. This one is maxillary sinus. Maxillary sinus. The maxillary sinus has a pyramidal shape. The base contributes to formation of lateral wall of the nasal cavity. Superior surface contributes to formation of floor of the orbital cavity, and the inferior wall is alveolar process of maxillary bone. This one is computed tomography of the paranasal sinus. This one are orbital cavity, this one is nasal cavity, and this one is maxillary sinus. Maxillary sinus, ethmoidal sinus, frontal sinus. The base of the maxillary sinus is lateral wall of the nose. The apex of the maxillary sinus is zygomatic process. The superior border of the maxillary sinus, superior surface of the maxillary sinus contribute to formation of the floor of the orbital cavity. The inferior wall of the maxillary sinus is alveolar process of the maxilla. This one is a horizontal section of the right and left maxillary sinus. When the maxillary sinus was normal, you must see dark area, like area of the nose, outer surface of the skull. This area contains air. The maxillary sinus contains air. For this reason, you must see dark color. But when the secretion aggregate into it and produce sinusitis, you can see this figure. This sinus is occupied by secretion of the maxillary sinus.